Namaste, ladies and gentlemen. Thank you all for logging in today. I welcome you once again to our continued conversations on our NASSCOM GCC Conclave platform. I'm sure many of you have attended our 11th edition of the NASSCOM GCC Conclave, which we organized this September. Rather than just a two-day conference that we do each year for this closely knit and strong community, this year, we have attempted to make this a series of year-long conversations going deeper into the key pillars that we focused on while building the content. Today, every business and every inch of its ecosystem has gone through a massive transformation to adapt and align itself to the new world. The healthcare sector has been at the forefront of this change and its future shaping up right in front of our very own eyes with advances in AI, AR, VR, 3D printing, robotics, nanotechnology, and especially human-centered design with a focus on helping patients improve their health outcomes at lower costs. Sensing the significant opportunity for improvement in the healthcare system globally, and the potential upside, organizations have been trying to break the propensity in order to drive rapid new business creation and scale up. Amidst these dynamics, governments, healthcare providers, and other stakeholders around the globe are being challenged to quickly pivot, adapt, and innovate. During our GCC conclave, one out of the four key pillars of the conversation was dedicated to breaking the propensity, wherein we touched upon how GCCs are rethinking their partnership models, collaborating with partner ecosystems to innovate, leveraging digital to expand or rethink the entire business model, and personalization. Going deep dive on this topic of breaking the propensity, we have with us today Shane Abeyratne, Senior Vice President and Global Business Services Head at Cardinal Health. Shane is responsible for the operations and growth strategy of global service delivery centers at Philippines and India. He was instrumental in successfully launching Cardinal Health International Philippines in 2017, and in 2021 opened Cardinal Health International India. His core focus remains in building a globally connected network of delivery locations that will empower the enterprise to address the growing needs of its customers with speed and efficiency. We welcome Shane onto this platform. Welcome, Shane.
Hey, Sandeep, thank you very much for having me. Good to be here.
Great to have you on board. And I believe you are dialing in from Melbourne, and it's pretty late in the night, early in the morning. Great to have you there.
Absolutely. No, it is a bit late, but great to be here. Thank you.
Excellent. So Shane, with a 3-year-old toddler, a newborn, and the longest lockdown in Australia, how does it feel today, traveling once again?
Yeah, it's a new world. It's an interesting world. I'll have to say that. I actually just had the fortune of traveling back the last 2 days ago, right? So it's very much different. I have to say, just the feeling of you got to prepare a lot more administrative things, rather than just checking in. You've got to go through your vaccination status and all of these other things that go along with that. But just if you kind of think about, we transit through Hong Kong and then through to Melbourne, the airports are not what they used to be. They're dead, quiet and isolated. So convenience is different, and it's not what I would say as enjoyable as probably it used to be. But you got to do what you got to do. I'm happy to just get back out and be able to kind of explore again and get connected with the teams. That's important, but it is different.
Awesome. And it's great to be also traveling once again. Even I just took a flight the other day and it was a completely different experience. So before we deep dive into our focus topic, Shane, just one more question, and for our viewers, actually, if you can just share in a line or two about your parent company, Cardinal Health.
Sure. Cardinal Health is a distributor of pharmaceuticals and a global manufacturer and distributor of medical and laboratory products, and a provider of performance and data solutions for healthcare facilities. We serve about 90% of US hospitals and more than 60,000 US pharmacies, along with 10,000 specialty physician offices and clinics. We provide more than 3.4 million patients with more than 46,000 home healthcare products. And our digital ecosystem to support medication adherence currently reaches more than 23 million patients and more than 60 payers.
Well, those are impressive numbers. And one of the things that you didn't mention was the turnover, the revenues, which are about 162 billion. And if I'm not wrong, you're within the top 100 Fortune companies, which is itself is huge in terms of numbers. Fantastic. So Shane, talking about the, in terms of your profile, as I introduced you, you've actually set up centers and GCCs in Philippines and India. Could you just tell us how different was it in setting up these operations in these two markets, your learnings?
Yeah, I think every market is different, no matter where you go in the world, but there are similarities and there are differences. I think the first thing you have to do is you have to understand what is the purpose that you want to achieve or unlock through kind of investing in a particular location. I've kind of said this many times before. Typically, people think about offshore locations as simply a cost play that cannot play and should not play in your decision-making process. It's a byproduct that you're able to get, but really you have to be centered around what is the purpose, what do you want to look at delivering, and what problems are you trying to solve. For us, we wanted to create some differentiated service offerings and clinical capabilities, which is what really allowed us to start looking at the Philippines. And the Philippines gave us access to over 500,000 annual clinical graduates, which is great access. And when you think about then being able to serve patients, clinics, hospitals in a differentiated manner, that gave us the ability to be able to do that and step up that way. For India, really for us, as we wanted to kind of embark on this new digital journey, we wanted to look at building core technical capability, not for what we need today, but what we're looking to do in the future. And India is uniquely placed with that kind of talent and that saturation of talent that really enables us to be able to get ahead of the curve and start investing in early.
Excellent. So let's start with the first question to you. In the last 18 months, how has Cardinal Health used digital to transform its own business models?
One of our 5 values that we have is being innovative, and innovation is at the core of who we are and a key factor of our success. By challenging the status quo and making shifts in the way we do business, we'll help our customers adapt and lead the healthcare industry through this change. We are a healthcare products and solutions provider, and significant investment will be required in the digital space to drive innovation. Teams across our company are using digital tools to transform logistics, procurement, sales and marketing, and much more. The value at stake is significant, and we've identified more than a dozen use cases and areas of opportunity that we really feel will improve the core business, customer experience, and create a new benchmark for what we call digital healthcare. This is how we'll really streamline our business and our processes to reduce waste and continue to grow and succeed. For us to really take full advantage of this, we've recently established an enterprise digital transformation office, and this will connect all of the digital efforts taking place throughout the organization and will help ensure we're prioritizing and acting with speed to take full advantage of the opportunities to transform ourselves and hopefully the industry.
Excellent. So Taking a cue from this, let's go into the first question on technology. Technology in itself has played a key role in enabling the transition of our new way of life, which has been triggered by the pandemic. Whether it was the way we live inside our homes, the way we work, commute, communicate, social distancing, virtual meetings, telemedicines, and much more. Now, these aspects have shaped consumer behavior too, directly and indirectly. My question to you is, how has the healthcare sector enabled and accelerated innovation to meet its customer needs in a rapidly changing global environment?
Digital healthcare is expanding at an unprecedented rate, and COVID-19 has accelerated healthcare digitization. There is an intense interest in digital healthcare by our customers and by our investors. And the time to act is now with speed to ensure that the healthcare sector embraces the digital trend more holistically and embed the power of these technologies to really be able to kind of unlock what we would say is some bold actions and a substantial shift from our current course.
Excellent. So let's get into your innovation center's role in India, which has evolved in supporting your parent company's transformation in the last 18 months. So how has that happened? How has your innovation center actually played an active role in this whole transformation strategy?
So as a global company, Cardinal Health aspires to be healthcare's most trusted partner by building upon really our scale and heritage of distribution, products, and solutions. And while driving growth in evolving areas of healthcare through customer insights, data analytics, and focusing our resources on what matters most. Our vision to build a connected network of delivery locations to build a platform that we can scale across the enterprise and attract top talent from the globe is really what kind of heralded for us the opportunity to expand our global model and help deliver these key initiatives across several key functions. In April 2018, we acquired a healthcare startup in Bangalore called MScripps, and that focused on patient prescription adherence and a messaging platform to deliver these solutions to several pharmacies in the US. MScripps had an original engineering base in Bangalore with approximately 50 employees or so. We've since kind of grown that footprint in India to more than 270 employees across enterprise IT, augmented intelligence, digital health solutions, and specialized business process management. And these areas, as well as places like master data management for our customers, suppliers, as well as our products, has just really helped us build and invest in some different capability. The India team is already an integral part of our commercial digital solutions technology arm, which is called Fuse. And that works across the healthcare ecosystem for payers, pharma manufacturers, and pharmacies. The team in India also focuses on e-commerce and mobile solutions to deliver an omni-channel experience for our customers. So really for us now, as we continue to expand our footprint, we want to really kind of grow that and 10x that in the way that we're thinking and going deeper in some of the new emerging technologies to really start creating some differentiated offerings, not only for our organization and change the way we do business, but for our customers and helping change the industry.
Awesome. In fact, I picked up a few stories on Fuse and I was quite enthused looking at the kind of work that you do. And it's also cutting edge work, which you are also leading at Fuse. Pretty interesting stuff there. Let's go into the next part of the conversation, which we have touched upon technology. We've talked about the innovation center's role. Let's go into the area of partnerships, and that's where the whole ecosystem will come alive. How have you at Cardinal, and not only from the India part, Philippines part, leverage strategic partnerships across the ecosystems to survive and thrive during these unprecedented times?
Yeah, great partnerships are critical and a key ingredient to success, absolutely. Besides our own center in India, Cardinal Health has strategic partnerships with several major IT service providers in India, and they were able to provide remote support during these times. We've also leveraged advisory services firms to kind of establish best-in-class practices as we build and grow our specialized talent pools in India. And we continue to also seek opportunities to leverage the vibrant ecosystem that exists in India as we continue the expansion of our footprint as well. So that includes some kind of technology partners and other more broader innovation groups as well that really help challenge the way you think today and push you to where we can go for the future.
Excellent. Just a follow-on question from the strategic partnership side. Is there a way that you create the collaboration or competition between the Philippines part and the India part? Do they compete, collaborate? How do you work that out?
There should be a healthy tension no matter which way you look at it, but I don't see it as a competition. I see it as really, when we say globally connected infrastructure, I like to think of it as a connected ecosystem, right? And the teams need to work together. The teams need to kind of fuel off each other. But more importantly, we need to try and map processes from the end-to-end perspective. And what's end-to-end? Not from our perspective, but from the customer's view back. And as we do that and truly get an understanding and comprehension of the customer journey, I think the real unlock comes in the ability for the teams to work together and really unlock the true value and potential to optimize, make things more efficient, and more importantly, work towards that journey of being healthcare's most trusted partner.
Fantastic. We'll jump to the next segment of the conversation, and that's where we're going to have the last segment. That's going to be a very interesting conversation with you. In fact, we all are trying to figure out what's going to happen in terms of the hybrid future. And I'm going to have a series of questions for you on that hybrid future. So my first question to you is that, when we look at the world, which we are moving more towards virtual and hybrid, how do you think leaders can build a culture which also reflects the entire organization's values? How do you build a culture around that?
We work really hard to live our values every single day, regardless of where we physically sit as leaders and employees. Culture continues to be focus number one at Cardinal Health, with a clear vision to who we are and what we see as our role in healthcare. We believe in integrity while being inclusive, innovative, accountable, and mission-driven. And this is built into our behaviors to invite curiosity, build partnerships, inspire commitment, and develop ourselves and others.
Excellent. So my follow-on question is, how will team structures, roles, and accountabilities change in this new environment?
I think the one thing that the pandemic has really taught us is that geographical borders are no longer barriers with the evolution of collaboration technologies and access to nourish global talent. Team structures will be more agile with the adoption of a more global mindset beyond boundaries. So really for us, it's kind of just pushing the standard to think differently and think about how you can kind of construct a virtual team that's still able to be connected and engaged around a common purpose.
So Shane, are you back in office?
I actually am, but because I'm at home at the moment, back in Australia, I'm not in office. But last whole week, I was back in our Philippines office for the last probably 6-7 weeks. And then in January, when I moved the family over to the US, we'll be going into office as well. So our US team go back into the office starting January, and our Philippines team have started going back into the office from October. And our new team in India will start a slow return in January as well.
Awesome. Okay, so Now let's jump to another part of the conversation in terms of training. What kind of training programs and retooling would be required for employees, especially the entry-level employees, where in-person hand-holding can make or break the entire difference as they join the organization? Over to you.
Yeah. Besides orientation programs, kind of focusing on business acumen and functional training, we're focusing heavily on digital fluency with an aim to improve digital IQ of all of our employees. And that's throughout the enterprise, regardless of role or level. We've curated content for basic, intermediate, and advanced digital courses to ensure employees stay focused on healthy and successful future. And really, you know, as we kind of look to this, there are different ways of onboarding people as well. So we start, you know, intentionally right at the start. How can you help people be connected and then give them the tools? So it's about putting those two things together. And that's kind of, I guess, way we're thinking about it.
Excellent. Let's go to another aspect of employees. You know, you've onboarded them, they're working with you, they're working in Philippines, they're working in India, in different locations, and they are always on. And this is a kind of always on, you know, way that we're looking at things. It's 2 a.m. where you are right now, and Shane, you're always on 24/7. So employee fatigue from always on virtual presence has emerged as literally the biggest challenge in the last few months. And, you know, we've been reading and seeing things that, you know, the kind of workload that was there in the physical side has actually increased exponentially as people have gone into the virtual in the existence as such. So have you been able to address it? And if yes, how have you been able to address this?
I don't think there's any silver bullet with this, right? I think everybody's evolving and learning. So what I would say is that the key is to be creative. And, you know, we try to be creative and ensure some fun in our virtual environment. This includes kind of team activities, encouraging employees to block time each week. We call it a midweek moment. And that's really to be able to unplug and take care of themselves, but more importantly, focus on things like development, their customers, and opportunities to kind of energize the team as well as the business as well.
So Shane, just looking at it from, again, the fatigue side, have these activities, have they actually had a pleasant, I would say, a positive impact as far as the employee wellness is concerned? A positive impact as far as you know, absenteeism is concerned, etc. Has it affected the morale also and motivated?
I think the feedback that we've heard has been positive. You know, people enjoy the ability to connect and disconnect, and you know, wherever possible. A lot of the success that we got specifically in our kind of global locations outside of the US was really around this feeling of community and family. And you know, when you're on site, you can do various different things, right, to kind of bring that to life, as simple as sharing a meal. So we try to take those essences and create that in a virtual context wherever possible. So if you're going to have a meal, why not have a virtual meal together and you know, kind of do some activities. Things like virtual escape rooms came up as a way of kind of breaking away from the traditional. So there's a way of being connected and then disconnecting, and being intentional around those two things have really been what we have heard from people as a way of kind of breaking away from what is the home office, lounge room, kitchen, bedroom, you know, one single place, and allowing that to really you know, create some differences, as well as involve the rest of the family in some instances as well, which just helps break it up. And then from a work perspective, I think people have probably enjoyed the collaboration differently, because typically you know, pre-pandemic, you would have had meetings, you know, virtually with different geographies, but not everyone would have had their camera, or there would have been a congregation of people in a room. And sometimes if you're the lone person out, that kind of keeps you out and puts you out a little bit. With this, and with everyone being virtual, collaboration has been at an all-time high because everybody's on a level playing field, everybody's connected, everybody's visible, everybody's active. So I just think it gives a great opportunity for inclusion as well.
Excellent. That's a great one. Now, putting on your leadership hat, and when you look at it from a more a different way of working, there is a lot of decentralization, decision making that is being taken place. How has this impacted global projects in areas of cost maintenance, quality, timelines, and even project objectives as such?
As a global company, we have a cohesive leadership approach that strongly bridges the gaps across time zones and continents. All of our kind of what I would say Cardinal Health International India, we call it CHII, based leaders have direct ties to the business and functional leaders across the company, with the corporate office to kind of ensure alignment and speed. If there's one benefit of the pandemic, it's that it's forced the teams, as I said before, to kind of work in a virtual environment. And over the last 18 months, if anything, it's really strengthened our ability to conduct business around the world, regardless of where any employee is physically located. And we've been able to really embrace agile ways of working and have projects led by agile team facilitators who are equipped to engage globally and on a common goal of the project as well.
Excellent. So one parting question, and in your 2 decades of career, you have worked at iSelect, you've worked at Telstra, and now at Cardinal Health. And I'm sure you would have had a wonderful number of mentors along the way. In terms of what is the best leadership advice that you have ever received, and how is it guiding you now today at Cardinal?
I think the best advice I ever got is probably something that's common and a lot of people would have said, and it's quite simply, pick the best people and get out of the way and let them be successful. For me, I tried to really ensure that everybody on the team is really, joins with them being able to build and bring the best versions of themselves to work. I truly believe that we have the best people, and from that standpoint, really it's empowering them to be able to deliver and unlock what they're capable of, and being able to support in any way. I really look to really leverage the best people possible and give them the empowerment and support to be able to go out and get what they need to get done.
That's a fantastic bit that you've learned, and I hope it creates a new line of leaders at Cardinal and wherever you go. But I must say it's been an awesome conversation. I must mention to our viewers that the last time we spoke, we talked also a lot about cricket. And I did mention to you prior to that, the T20 World Cup was taking place, and who were you supporting? Whether it was Sri Lanka or whether it was Australia, and you said Australia. And of course, well, this one's on your mate. Australia won.
Yeah, I couldn't lose on this one. I had two horses in the race, right? So one horse came through. So thumbs up.
Excellent. And Shane, thank you so much. And I'm going to take you up on your offer, which you mentioned last time. The next time you're in India, we definitely will meet up in person and continue this conversation. This has been really a fascinating conversation where we have covered quite a lot in terms of technology, in terms of the future of work, in terms of the way things are shaping up as far as innovation is concerned, the business models, and how things are changing with you at the helm as far as Cardinal Health is concerned. And I'm going to wish you all the very best in your journey ahead, and look forward to many such interactions, Shane. Pleasure having you.
Awesome. Thank you very much for having me, Sandeep. Great to be here, and I definitely will take you up on that.
Excellent.
All the best. And
I also thank our audience for tuning into this conversation. As always, we would really appreciate your feedback. You can write into us at events@nasscom.in. We have a series of conversations lined up with leaders in the coming weeks, so please continue to stay tuned in and look forward to meeting you virtually at our sessions very soon. Until then, stay safe, stay healthy. Bye for now.